Good morning and welcome. My name is Kim Sandifer and I'm one of the Hurst Review instructors. I'm so happy to have you here with me this morning. We are going to talk about diabetes and we're going to talk about type 2 diabetes in particular. One of everybody's favorite subjects, right? We're so excited. I know I'm excited. Well, we're also going to do a couple questions when we get done talking about type 2 diabetes. So you want to stay tuned for those. I know students love to do questions, right? So let's talk about the pathophysiology of type 2 diabetes really quickly. These clients do not have enough insulin or they have become insulin resistant, okay? So they do not have enough insulin or they've become insulin resistant. Let me ask you a question. Is this person's pancreas still working? What do you think? What do you remember? Yes, it's working a little bit. They don't have enough insulin, and this client is not going to be breaking down fats. The client typically have enough insulin to keep them from breaking down their fats. This is one of the key differences in type 1 and type 2. Will this client go into metabolic acidosis? What do you think about that question? Well, if they're not breaking down fats, they're not going to make ketones. No ketones, no acidosis. That's one of the big differences in type 1 and type 2 diabetes. In type 1, there is very little to no insulin. And in type 2, they don't have enough insulin or they are insulin resistant, but they do not go into the metabolic acidosis, okay? These clients are typically overweight. This client is typically overweight. They cannot make enough insulin to keep up with their glucose load that they're taking in. This type of diabetes is not usually found as abruptly as our type 1 diabetic. Type 1 is pretty abrupt. They end up in the ER in DKA, right? That's pretty abrupt. Type 2 is a little more sneaky. In other words, it's found by accident. They keep going to the doctor for different things. Maybe they have a wound that will not heal or repeated vaginal infections. Now, let me ask you a question. Why would this person have such a hard time with recurrent infections or maybe a wound that will not heal? What do you think about that? Well, what does this client have building up in their blood? That's right, they've got excess glucose. Excess glucose, and bacteria thrive in that environment. They absolutely love it. And excess glucose can also cause your immune system to dysfunction. Did you know that? So a person with hyperglycemia, lots of sugar in their blood, they cannot fight off infection like healthy people do. Let me ask you another question. Is this diabetic's circulation impaired? Yes, they have a decreased blood supply, and that is why they're also more susceptible to wounds that will not heal. Now, with type 2 diabetes, they need to watch their diet and exercise. Their diet and exercise. In some people, that is all they need. They just need to gain a little control over that diet and exercise. Some people have to add oral agents, oral medications. And remember your teaching role when you have someone with diabetes, because they think, because now they're on the sugar pill, that they can have anything they want. Is this true? No, they cannot have anything they want. And then some people that have type 2 diabetes will end up on insulin to control their blood sugar, especially if they are not compliant with their diet and their exercise. All right, so that is a really short review of type 2 diabetes. Are you ready to answer some NCLEX questions? So the way this will work is there'll be a question that comes up on the screen. It's an NCLEX style question. And here we have our very first one. Take a minute and read that and see if you can come up with an answer. All right, so who loves select all that apply questions? They really are not that bad when you use your testing strategies to look at each option as true or false statements. In this question, we are wanting to know the risk factors that the nurse would include in teaching about a type 2 diabetic. Option number 1 in this question, the client with type 2 diabetes being overweight, that is a very important risk factor, and that would be included in your teaching. Now let's look at number 2. It says being underweight. Y'all, we just said that most type 2 diabetics make a little bit of insulin, but they cannot keep up with their glucose load, and so they store that extra glucose as fat. So option number 2, being underweight, is not true. The client with type 1 diabetes may have some unexplained weight loss. Now let's look at number 3. Having type 1 diabetes as a child increases your risk of type 2. Y'all, those are two separate things. They do not overlap, and having type 1 does not lead to type 2. That is just wrong. Option 4 says Caucasians are more likely to develop type 2 than Hispanics. Y'all, our textbooks say different. The current information says that Hispanics, followed by African Americans, Native Americans, and Asian Americans, have the highest rate for diabetes. This is just a fact, and you want to make sure you include that in your teaching. Now lastly, let's look at number 5. What do you think about number 5? Polycystic ovarian syndrome. Well, PCOS. It is a hormonal imbalance, a cystic disorder. Women who have this are at increased risk for type 2 and also for cardiovascular disease. This should be included in your education about risk factors. All right, are you ready for one more question? Read this question and decide your answer. Okay guys, in this question, we are trying to prioritize what must be told to this client to decrease their risk of developing type 2 diabetes. Sometimes all of the options might apply and you get to pick just one. So, if you are teaching one thing, what is the most important thing to teach them? Well, number 1 says maintain normal iron levels. What do iron levels have to do with diabetes prevention? Nothing. Let's look at number 2. It says to test your serum glucose before meals and at bedtime. Y'all, this is just too excessive. That is a no. If they have diabetes, they may need to do this, but they're not there yet, so that is just too much. Number 3 says avoid carbohydrates in the diet. Well, we know that carbohydrates can affect your blood sugar, right? Yes, they can. This is why we have diabetics to count their carbs. However, they don't avoid them altogether, do they? No, so this is incorrect. Now let's look at number 4. It says obtain a normal body weight through regular exercise. Body weight is the most important factor in the development of type 2 diabetes mellitus. The normal body weight being imperative here. Regular exercise reduces insulin resistance. This will lower the insulin levels, reduce the hepatic production of glucose, and so this one is correct. Obtain a normal body weight through regular exercise. All right, thank you guys for joining me for a quick review of type 2 and answering these 2 questions.